Preparing a surgical pack for sterilization. Preparing a surgical pack for sterilization is a sterile and aseptic technique for preparing packs of surgical tools and equipment to be placed inside of an autoclave. This is essential for all surgery procedures. The sterilization process is necessary before the tools can be used in a surgery. A vet assistant or a vet technician in a veterinary hospital can properly prepare a surgery pack for sterilization. The first step is to gather the appropriate instruments and instrument pan if applicable. Most veterinary clinics will have a specific recipe for the types of different surgery packs. They might have a specific one for a spay pack or a wound pack or an orthopedic pack, and based on that, they're going to have a list of specific tools and quantity of tools for those packs that they would like. Each facility or doctor in a facility may even have a specific way that they want their pack packed as well. Step 2 is to gather additional supplies if applicable. If you are going to be adding gauze pads into the pack, you're going to want to make sure you count every single gauze pad correctly, following the recipe of how many gauze pads would like to be in that pack. And the reason why is because at the conclusion of the surgery, you're going to want to make sure that you count every gauze pad as well to make sure that none are accidentally left inside the surgery site. Step 3, select the appropriate packaging material and a chemical indicator. Step 4 is to assemble the pack correctly by following the instructions on the checklist or recipe, making sure that you are using those correct tools and the quantity of tools that are necessary. Step 5 is to place the chemical indicator in the correct area of the pack. Step 6, properly wrap, secure, and label the pack. Every clinic may have a specific way that they want the pack labeled. You're always going to want to make sure that you include the date at which it was packed, the initials of who packed it, and then a title for the pack. Some facilities will even have numbers that relate to different types of packs. For example, maybe a 1 is a spay pack, maybe 2 is a wound pack, etc. In this slide, there is an example of the process of properly wrapping the pack.
Hi, my name is Courtney Jones. I'm a registered veterinary technician, and today I will be properly demonstrating how to prepare a surgical pack for sterilization. To start, I'm going to ensure that I have all my instruments and my instrument pan if applicable. Some clinics will use an instrument pan for something like a laceration pack where all they need is just a few materials. But today we will be preparing a spay surgery pack, so I will be using quite extensive materials with my tray. Almost anyone in the veterinary hospital can prepare a surgery pack for sterilization. Veterinary assistant, technician, kennel assistant, what have you. Some clinics even have specific staff for surgical prep. And so in some places you don't have to worry about that at all unless that is your job title. I'm going to make sure that I have, like I said, all my supplies and additional supplies if necessary. I have my tray, all my materials, my gauze sponges, my chemical indicator tape, and my chemical indicator strip. I will then make sure that I have the appropriate packaging material. So with my tray, I'll have 2 layers of surgical drapes, an inner drape and an outer drape. So the inner drape will act as the sterile portion and the outer drape is what us as surgical assistants will be opening for the veterinarian. I'm going to make sure I assemble the pack correctly and follow my recipe that I have provided. So I will start, we have 1 scalpel blade, 1 rat tooth forcep, a brown Atson forcep, a snook hook, 1 pair of the Olson Hagar needle holders, one Mayo dissecting scissor, a Metzenbaum scissor, 1 cryo forcep, and a Kelly forcep, 1 straight and 2 curved mosquito forceps, towel clamps, and lastly 20 gauze sponges. It's very important that we count the gauze sponges so that at the end of the surgery the veterinarian or assistant can then count the gauze sponges to ensure that we have the appropriate amount after surgery as well. As you can see, I have additional instruments here that we will not be using, so I will go ahead and put these out of my way. And then I'm going to assemble my pack correctly now that I have all of my instruments from the recipe. It's up to the doctor or the clinic on how you pack the tray, but today I'll show you how I do it. So I'll make sure I place all of my forceps, my scalpel blade, anything without a true handle out of the way. Once I've done that, then I'll be able to organize my forceps. I like to organize them tallest to shortest, and so I'll start with my scissors and then go on to my forceps. And with my curved forceps, I do want to make sure that they're curved outwards, not inwards towards my hand. It's just the way that we practice here. Once I have all of them organized, shortest to longest, then I'll go ahead and just gently place them in my tray. Doesn't have to be pretty. And then I'll take my 2 forceps and just lay them on either side, along with my snook hook and scalpel blade, which I will lay on the opposite side I laid my forceps on. Once I've completed that, I'll lay my gauze into the tray, and I always like to put the towel clamps on top of the gauze, so that's the first thing that the doctor reaches for when they attach the drape to the patient. Once my pack is then packed, I will go ahead and place my chemical indicator strip directly into the middle of the pack. I like this to try and be exactly in the middle of the pack so that we know that steam has reached the center of the pack and that this has been properly sterilized. So to wrap my pack, I will make sure that I have the appropriate packaging material like we stated before, my inner drape and my outer drape. And like I said, this inner drape is going to act as that sterile drape. I will start by flipping over the first flap over the tray so it's completely covered, and then making a little tab right at the top so that they can grab that. I'll go ahead and pull it tight so that we don't have excess material bunching. And then for the sides, I'll go ahead and just make a small crease so it's not so bunched, and then flip it on the side. And I will actually make another tab on the sides of these drapes as well, so it's easier for the sterile assistant or veterinarian to pull. And then we're going to match that same thing on the other side as well. And then for my last flap, like I said, I'll go ahead and make sure that not a lot of material is bunched, and then I'll go ahead and take this whole flap, flip it over the entirety of the pack, and all this excess material, I'm just going to tuck underneath those flaps. And I want to leave enough of a tab so that the veterinary assistant or whoever is sterile opening this inner drape is going to be able to grab that easily. And then we repeat that process with the outer drape. And I always make sure that this little tab is going to be pointing towards me so that when we open this outer drape, we don't have to flip the pack. So again, take the first side away from you to cover the entirety of the pack. Pull it tight so we don't have excess material. Take your sides and flip them over. And make sure you put that little tab on there so that the veterinary assistant can grab that easily. Repeat on the other side. And then lastly, take all that material and over the entirety of the pack and under those flaps. Now that we have completely packed our spay pack, I'll go ahead and take my chemical indicator tape and place it on the outside of the pack to keep this pack closed. We can see that this chemical indicator tape is very light, almost looks like packing tape. But if you can look closely, we see little lines going across. So once we put this through the autoclave, these little white lines will turn black, and that is how we know that this has been properly autoclaved. When we wrap and place tape on this pack, we do write on the tape what the pack consists of. So this is our spay pack, so I'll go ahead and write that this is our spay pack, the date we packed it and autoclaved it, who packed it and autoclaved it, so your initials, and then the expiration. When we autoclave and sterilize all of our packs, they will expire 1 year later. And so I'll go ahead and put that date on there as well. And that is how you properly prepare a surgical pack for sterilization. I'm going to properly demonstrate how to prepare a surgical pack for sterilization. I'm going to start by gathering my appropriate instruments and instrument pan if applicable. I'm going to gather additional supplies if applicable. And I'm going to select the appropriate packaging material and chemical indicator. I'm going to assemble the pack correctly by following the instructions on the checklist or recipe. 1 scalpel blade, 1 rat tooth forceps, 1 brown Atson forceps, a snook hook, 1 Olsen Hagar needle holder, 1 Mayo dissecting scissor, and a Metzenbaum scissor, 1 Cryle forceps, 1 Kelly forceps, 1 straight and 2 curved mosquito forceps, and my 4 towel clamps. And 20 gauze sponges. I will place the chemical indicator strip in the correct area of the pack, which will be directly in the center or middle of the pack, and I will properly wrap, secure, and label the pack. For my chemical indicator tape, I will place on the pack with the name of the pack, when it was packed, my initials, and when this pack will expire after autoclaved.
In summary, to prepare a surgical pack for sterilization, you will want to gather the appropriate instruments and instrument pan if applicable, gather additional supplies, select the appropriate packaging material and a chemical indicator, assemble the pack correctly by following the instructions on the checklist or recipe, place the chemical indicator in the correct area of the pack, and then properly wrap, secure, and label the pack.